Dan from Jump Bag here, and we're getting ready to jump into our next section of our workforce safety and wellness. And we are starting off with scene safety. We've covered a couple other bits and pieces, so let's keep rolling. So scene safety, this is a biggie, guys. This is a biggie. The first thing they want to talk about in the textbook is hazardous materials. And so when we're dealing with hazardous materials, we want to look at things from a distance because you don't want to get too close. If you can smell it, if you can taste it, if you can see it, you're already in a bad spot, right? So you want to look from a distance with binoculars. You want to be uphill and upwind. You're going to look for labels, placards, identification numbers from that safe distance. You're going to want to call for those additional resources to include a hazmat team. And before you're touching those patients, you got to make sure they're deconned. Remember, whatever they got in there, they're bringing out with them until they're cleaned up. You throw them in the back of your rig, you're going to be in a bad spot because you're in that hot zone as soon as you bring them in there. So keep your distance, call for help, and look for those placards. A great resource is your ERG or your emergency response guide. And any placards, any numbers you see, you can look them up in your ERG. So that'll give you your general ideas of how far away you need to be and what your initial steps are. And don't forget to call that hazmat team. All right, so electricity. This is beyond our scope. This isn't anything that we're going to deal with other than the fact that somebody got shocked. All right, so if there's a down power line, if there's live electricity, you've got to call the power company, call the fire department, bring in that outside help. And if it is an electrical line, you want to stay one pole span. What I mean by that is if you got two poles right here and the line is or the break is in the middle, you're going to want to go to that next span and no closer. You don't want to get any closer than that because electricity will travel. Also, if there's lightning, just know that just because it struck once doesn't mean that it won't strike twice. It can come right back to that exact same spot. And that electricity, when it hits the ground, it radiates out. So if you're in the gradient where that electricity hits, you can get a little bit of that juice. So watch those gradients. And then you want to try to stay as low as possible. Make yourself a small target. If you do have tools and equipment, go ahead and get rid of those and get on the ground. Try to find a place with some cover. You want to avoid drainage ditches, moist areas, small depressions. And this was always my favorite because you just don't think about it. Wet ropes. Any of that stuff is going to help transfer that electricity. It's looking for a home. And if you're in the wrong spot, well, it's going to be us. All right, so fire. Pretty straightforward on this one, guys, but I'm going to read you what they say the common hazards are straight out of the book. So you've heard it, you'll read it, and you'll know it when you see it. So the common hazards with fire: smoke, obviously. Oxygen deficiency. Remember that fire is breathing, right? It's sucking that O2 in just like you want it. High ambient temperatures, it's a fire. Toxic gases, building collapse, also a lot of equipment and explosions. When things get to a certain temperature, they can actually get pressurized and explosions can happen, whether it's a product or even if it's just the fire itself. If oxygen is introduced into an area that's oxygen deprived when that fire is going, when it gets what it needs, boom, you can have that flash over, that backdraft. We've all heard that term before. So with fire, this isn't our jam. Call for the fire department, get those additional resources, and keep yourself safe and back until those special resources are there doing work and they call you forward. All right, so vehicle crashes. This one, we go on a lot, but we don't always think about all the hazards. If the road is wet, if there's broken glass, if there's broken metal, all that stuff that once hurt the patient can now be hurting you. It's a threat to you when you're going out there. Also, you've got traffic going by. You can deal with weather, slopes. You've got to have your head on a swivel. You've got to be looking for safety. Wear your vest, something that is going to make you stand out in the crowd. So if traffic is coming by, they're going to see you. Also, if you can use your ambulance to block traffic, you can bring some cones out, try to get law enforcement to block those areas. And don't forget, anytime we're doing any of this stuff, look for those additional resources. There's a tool in the toolbox. Okay, so there's different size sockets, there's different types of wrenches, there's different types of screwdrivers. They're all tools, but they're different tools for different purposes. So when you get on these scenes, think about what resource do I need, and then call that additional resource in. Fire department, rescue, tow truck, law enforcement, whatever the case may be. So coming up next is our scenes of violence. So these could be your assaults, hostage situations, riots, fights, domestic violence, mass attacks, any of those. We might go on any of those types of attacks. So scene assessment begins when you're en route. When you're on the way there, you want to know what it is you're dealing with and get as much information from dispatch as possible. You want to get a general idea of where this location is and is there a safe route? Is there a certain direction you're supposed to drive? Is there a certain spot where they want the ambulances to come and go? Is there law enforcement on scene? Once law enforcement is there and you know the scene is at least safe-ish, right? The scene is safe. You can go in to do what you need to do. Keep your head on a swivel again, because things can change. Now, if this is a crime scene, try not to move anything you don't need to move. Law enforcement is going to be doing their thing, and they are going to be looking at all of this as evidence. And if you start moving things, that could be disturbing the crime scene, and that could affect the case later on. But again, you're there for patient care. So if something's in the way and you need to do work to save a life or to help that person, that's what you're there for. Life safety, right? So get in there and do your work, and always remain vigilant. Things change, and call for help if it gets unsafe. If you don't have enough people, call more. If the police aren't on scene, back off if you feel like you're in risk. See, so now we're talking PPE and preventing injury. This one is pretty simple. Wear your PPE. You've got gloves, you've got gowns, you've got goggles, tools in the toolbox. What is it you're dealing with, and what would be the appropriate PPE? Splash protection. I think of childbirth. That can be a messy situation. There can be a lot of fluid. So having the gowns on, having the face mask, the splash shield, glasses, gloves, all those things are going to keep their fluids off of you, right? It's not just keeping your germs from them. It's also keeping their germs from you. So if your agency provides it, know how to use it and know when to use it. Now, when it's cold out, we go to our cold weather gear, and these typically consist of 3 levels or 3 layers. Kind of silly, I know, but this is the kind of stuff they look for in the test. So 3 layers for your cold weather gear, and they are a thin inner layer that pulls moisture away from the skin, a thermal middle layer that's going to serve as insulation to keep whatever you got going inside there, right? So warm in, cold out. And then the outside layer, which is going to resist wind, rain, sleet, and snow. So protecting you from those elements. So those are the 3 layers of your cold weather PPE. Now, let's talk a little bit about caring for critically ill and injured patients.